Good evening, everyone, or good morning to those joining us from Korea. Welcome to GW Institute for Korean Studies, or GWIX. I'm Yeonho Kim, Associate Director of GWIX. Thank you for joining our Korea Policy Forum on COVID outbreak in North Korea, a political economy of the public health crisis. Today's forum is co-sponsored by the East Asia National Resource Center at GW and the Korea Institute for National Unification, or KINU, in South Korea. With that, let me turn it over to Jisoo Kim, Director of GWIX, and Yuhan Ko, President of KINU, for opening remarks. Jisoo?
Thanks, Yeonho. Welcome to our Korea Policy Forum event. Good evening and good morning, those of you in Korea. We normally don't have events during the summer break, but it was necessary to host today's webinar, which is a very timely and important topic. When the world was suffering from COVID-19 during the past 2 years, North Korea claimed there were no cases in the country. Regardless of its veracity, things have changed starting May of this year, and North Korea officially confirmed COVID cases in their country. This, of course, raises so many questions as to how serious it is, why North Korea acknowledged their cases, what measures they have taken, what kind of public health crisis they're dealing with, whether they will accept humanitarian aid from South Korea, etc., etc. So for making today's webinar possible to have meaningful discussions, I would like to thank President Yuhan Ko at the Korea Institute for National Unification for co-sponsoring today's event. And this is our first time working together. I hope the two institutes can continue to collaborate in various ways. I would also like to thank our distinguished speakers from both Korea and the US for sharing their expertise with us. There are not that many experts who can speak about today's topic, so I feel we are very privileged to learn from our distinguished speakers. I very much look forward to hearing their insightful views. Thank you.
Thank you, Jisoo. President Ko?
네, 안녕하십니까. 통일연구원장 고유환입니다.
Morning, I'm Ko Yuan, the president of the KINU. KINU and the GWIX are hosting this seminar together, and I deliver my sincere appreciation to you all who are gathered here today. And also, I want to thank many of you who made this event possible. Jisoo Kim, director of the GWIX, and Deputy Director Yeonho Kim, thank you once again. I met two of them when I visited Washington at the end of last year, and the two institutes agreed on working together with close cooperation. And this is the first outcome of our collaboration. I want to thank all those who worked really hard in planning this seminar from GWIX and KINU. And I sincerely hope we can continue this kind of collaboration. North Korea on May 20th held the 8th Political Bureau meeting of the 8th Party Central Committee, and they made a decision to switch to the maximum emergency quarantine system. And after that, North Korea released the national statistics about the fever patients and the deaths from the Omicron. The situation tells us that North Korea is now suffering from a nationwide infection from Omicron variant. The number of the new fever patients is declining from 100,000 to 30,000. As of the June 20th, the total number of the patients was around 4.64 million. This means about 1/5 of the North Korea's total populations were infected. And also, the TB is increasing as well in North Korea due to international sanctions and North Korea's self-lockdown due to COVID-19. The economic difficulties are getting bigger. In addition, pandemic and drought will make unfavorable conditions for food production this year. To resolve the stalemate between the North Korea and US after the Hanoi, the Biden administration and Yoon Suk-yeol administration offered talks without any conditions attached. However, North Korea has not responded yet. While North Korea is currently working on the missile provocations and they completed preparations for the 7th nuclear test, the tension on North Korean and Korean Peninsula is intensifying. As such, we are in a critical juncture where the inter-Korean relations may once again be engulfed into a turbulence. On May 21st, the leaders of the Korea and the US reaffirmed their commitment to humanitarian aid to North Korea and expressed their concern about the outbreak of COVID-19 in North Korea. Furthermore, South Korea and the United States expressed their willingness to cooperate with the international community to provide necessary support. While KINU collected the data announced by the North Korean media and updated the current status of the COVID-19 in North Korea on our webpage. And also we are providing lots of the healthcare cooperation related information. So I sincerely hope that the seminar jointly hosted by the KINU and the GWIX can lay the foundation for the discussion of the needs for the healthcare cooperation between the two Koreas, and we can find a way for the reconciliation and harmony for the future. And once again, thank you very much for the experts from Korea and the US. Thank you very much for your contribution once again. And for those of you watching us on Zoom, thank you very much. Please stay tuned till the end of the event. Thank you very much.
Thank you, President Cole. With that, let me start our roundtable discussion. We are lucky to have 5 distinguished speakers today, joining from Seoul, Washington, and Vienna, Austria. Let me introduce the Korean speakers first. Ute Lee is the Director of the Humanitarian and Cooperation Research Division at KINU. He also serves as an advisor to the Center for
안녕하세요. 통일연구원
Human Rights
이우태입니다.
Records
반갑습니다.
at the Ministry of Unification. Jae-Hwan Hong is a research fellow of the North Korean Research Division at KINU. He also served as the director of the division in 2021.
예, 안녕하세요. 통일연구원 홍지안입니다. 반갑습니다.
Our next speaker is Bill Brown. He is chair of North Korea Economic Forum at GWIX. He served as an economist and East Asia specialist at CIA Commerce Department and National Intelligence Council. Ken Goss is the director of the Adversary Analytics Program at the CNA Corporation. He's a noted expert on North Korean leadership and the author of several books on the topic. And last but not least, Rachel Minyoung Lee is the Regional Issues Manager and Senior Analyst for Open Nuclear Network in Vienna. She was a North Korea collection expert and analyst with the US government. With that, let me turn it over to Ute Lee, and ask him to assess the COVID outbreak in North Korea.
안녕하세요. 통일연구원 이우태입니다.
Morning, I'm Iute from KINU. Today, my role is to tell you about something, and also I'm the icebreaker for today's session. Today, I'm going to give you the high-level information about the outbreak of the COVID-19 and the spread of the COVID-19 in North Korea so that you can have in-depth discussion after my talk. President Cole mentioned already, as of the June 19th, and they have around 19,000, and currently they have less than 10,000 COVID-19 confirmed cases. So in our institute, we are now watching the confirmed cases in North Korea. When you take a look at this one, and after the 12th of the May, the number increased to 300,000. However, after 10 days, the number was cut in half. On the 16th of the May, there was around 390,000. However, the number has been dropping significantly. As of the last Sunday, it was below 10,000. As of yesterday, it is around 10,000. North Korea is now reducing the number of the confirmed cases. Let's think about the history about the COVID-19. As you can see here, at the end of the April, according to their report, there have been many people who were suffering from the fever. Starting from the end of the April, the North Korean authorities said the COVID-19 is spreading across the country. They recognized that situation. On the May 4th, they imposed temporary lockdown in Pyongyang City. And after that, the fever was spreading, so a lockdown was resumed. So starting from the May 1st to the May 10th, the North Korean authority were fully aware of the COVID-19 and they were thinking about the measures to take. However, around 7 to 10 days, a critical measures were not taken. Probably that is why the COVID-19 was widely spread. So on the 12th of the May, they started to work on the maximum emergency virus control. Then now let's take a look at what led to the spread of the COVID-19. In April, there was a 110th anniversary of the Day of the Sun, and there was a 19th anniversary of the Korean People's Army. For more than a month, around 20 to 30,000 soldiers and students stayed in Pyongyang for more than a month for these ceremonies. In January, the border was opened between North Korea and China. And after the Dandung's case, Dandung had some confirmed cases, so the border was closed again. So between the Dandung, when we are taking a look at the timing, and probably from the border area, the COVID-19 virus was coming from Dandung to North Korea, considering the timing. And let's take a look at the total number of the confirmed cases and the total number of the deaths. Even though you are diagnosed with the COVID-19, in Korea, 25% of them are asymptomatic, while 30% of them are having some fever. However, in North Korea, they are focusing on the number of the patients suffering from the fever, which means the actual number of the COVID-19 patients could be 4 to 5 times of the reported cases. And another factor is the death toll or the fatality rate. In North Korea, they have around 4.6 million confirmed cases. However, only 73 people died out of the COVID-19, which means the fatality rate is 0.0016, which is 1/375th of death toll in Korea. So we are suspicious about the death rate. Of course, Korea and United States offered the humanitarian hand for the vaccine support. However, North Korea did not respond. COVAX has provided the vaccine to North Korea, and however, the Chinese vaccine's volume or how it can be circulated is not sure yet. However, according to the report, more than half of the Pyongyang citizens have been immunized and the border postcards have been vaccinated. However, some of the vaccines are traded at the Changmadang. It's a kind of the black market, and the trading price is around 91 USD in Changmadang. The South Korea's Ministry of the Unification forecasts that North Korea is likely to claim to be out of the COVID-19 situation. Probably they can announce at least. Currently, they have around confirmed cases of the 5,000 to 10,000. If that kind of situation can be continued, probably North Korea can declare they are free from COVID-19. Last but not least, the international society is dubious about the data from North Korea, and Rachel will talk about this more. But let's take a look at this one. Let's take a look at the shape. You can see the confirmed cases. And you can see this is more like a reversed triangle. However, in Korea, it is a bell shape based on the Omicron cases. In the US, you can see the bell shape. Starting from December, there is a bell-shaped graph. In China as well, starting from March, Omicron variants were found. Overall, it is the bell shape as well. And in the roundtable, we can compare the characteristics of the China versus North Korea. So I picked some random country, and you can see Bangladesh. Bangladesh has a bell shape of the graph. So once again, I can say the North Korea's data is a bit unusual compared to the normal trends across the globe. Last but not least, let's take a look at the death. This is the death toll from North Korea. This is really unusual. And they have many deaths, but now they do not have almost any deaths. This is the death after the Omicron variant. And you can see the bell-shaped data. The same in the US, the bell shape. In China, you can see the bell shape. In Bangladesh, yes, the data is bell-shaped. This means the deaths coming from the Omicron variant is bell-shaped. However, the North Korea's data is unusual and rather strange, and I don't think the data is really reliable. That's it from me. Thank you very much.
Thank you, Ute. Let me ask Rachel to discuss how she's dealing with the dilemma of dealing with North Korea's official data from an analyst point of view. Rachel.
Thank you, GWIX and KINU, for inviting me to share my observations on this important and timely topic. Dr. Ute Lee of KINU has provided an excellent overview of North Korea's COVID situation and ended his presentation with some questions about the reliability of the data provided by North Korean state media. I think we have a good reason to be skeptical about the data provided by North Korea. That said, I will focus on the North Korean coverage of the COVID outbreak from a media analysis point of view. When North Korea started providing numbers of new cases, recoveries, and even deaths, the natural questions many people were asking were, are these data accurate? And is North Korea telling the truth? I think it is crucial that we differentiate between fact and intent. And this perhaps captures the essence of North Korean media analysis. The veracity or credibility of the numbers is a question best left to medical experts in this case. Media analysis of North Korean COVID data focuses on regime intent. In other words, why North Korea is covering the COVID outbreak the way it is. The general assessment, and one that I agree with, is that North Korea's rare acknowledgement of a disease outbreak was driven by need. By May 12th, when North Korea held a Politburo meeting to discuss the outbreak and made the announcement, the disease was already beyond quiet containment, and North Korea decided to confront the issue head-on for effective management of the situation. The leadership needed the people's buy-in and cooperation before upgrading the national quarantine system to the maximum emergency quarantine system. Heavy concentration of cases in Pyongyang in the beginning also seems to have figured into North Korea's decision to announce the COVID outbreak. Pyongyang is where the majority of the country's elite live, and Kim Jong-un and his associates probably felt compelled to publicly acknowledge the situation and show the people that it was managing the situation quickly and effectively. Daily tallies that include breakdowns by region and even the number of deaths are unprecedented in North Korea, even when we take into account increased transparency under Kim Jong-un. This level of disclosure seems to have been driven by a dire need to keep the public informed for effective management of the situation. And it is also in line with how North Korean state television carried live relays of on-the-ground reporting during the typhoons back in the summer of 2020, despite the risks associated with live relays. If North Korea had wanted the flexibility to fabricate numbers to portray the situation as being better than it is, it likely would not have provided such detailed daily tallies to start with. This is not to say that the daily tallies are accurate or inaccurate. What I mean is that North Korea would have provided less details if it was considering fabricating numbers in any significant way. North Korea's latest coverage of COVID indicates cautious confidence in controlling the epidemic, which is in keeping with the significant decline in quote unquote fever cases throughout the country. So at the recent party plenary meeting, North Korea said Kim Jong-un discussed plans to finally overcome the vicious epidemic crisis and restore stability, suggesting the country is entering or has entered the final stages of overcoming the public health crisis. This is not to say that the country actually is entering or has entered the final stages of overcoming COVID, but that's how the state media are portraying the situation. Also worth noting is that Kim Jong-un at the plenary meeting talked about the next steps, including building a national crisis response system based on the lessons learned from the epidemic. However, it should be noted that North Korea continues to impose the maximum emergency quarantine system, despite describing the COVID situation as stabilizing. This indicates that the North Korean government does not yet feel the situation has stabilized enough to lift the maximum quarantine measures. The North also continues to use the extremely rare formulation of great upheaval since the founding of the state. When North Korea first acknowledged the COVID outbreak, some experts noted that it was aimed at publicly soliciting outside assistance or paving the way for re-engaging the outside world. If publicly soliciting outside help had been North Korea's goal, I think we should have seen more dire reporting via external media outlets like KCNA, but that was not the case this time. There is no indication yet in state media that Pyongyang is ready to re-engage the outside world here meaning the US and South Korea anytime soon. But against the backdrop of Kim's letter to Putin last week and the latest party plenum's reaffirmation of continued weapons development, Che's promotion may not have the desired effect of bringing North Korea back to the negotiating table anytime soon. Even if Che Sun-hee has been appointed to prepare for an eventual resumption of dialogue with Washington, I think that she would be up against an overwhelmingly hardline view within the Pyongyang leadership of the global security situation. And all in all, I think North Korea seems to be using the COVID outbreak to strengthen party control across the board. During the many meetings Kim Jong-un presided over in the wake of the COVID outbreak, he repeatedly emphasized unconditionally obeying the party. There was also a heavy emphasis on party leadership and party discipline at the latest party plenum and the party secretariat meeting that followed. And I'll conclude my remarks here now.
All right, Rachel, thank you so much. You spoke about 6 minutes within the maximum amount of time you were assigned. And our next speaker is Bill Brown. I'm going to ask him to discuss North Korea's COVID crisis management capability. Bill.
So Yunho asked me to look at the crisis management problem for North Korea, which is kind of hard given I'm here in Herndon, Virginia. But it is an interesting way to look at it. How are they organized to do this? A couple of new data points that I'd like to add before I start is just today, yesterday, the trade data came in from China. It showed, the train stopped going. And so May trade was a huge drop from April. It's gone back to what it was earlier in the year. So there's apparently not a lot of stuff coming in like there was last month. This in terms of all kinds of medicines and foods stuff. Never was very much. but it's dropped even further again. And also, I think, last week, 2 weeks, we talk about drought or weather, right? I think tell me if I'm wrong, but I think the drought has ended. I think the rainy season came in last week and they're getting their normal kind of rain. So the drought issue will quickly turn to a rainy season flooding issue, I'm pretty sure. Maybe a hurricane issue. This makes me want to emphasize the point that North Korea is always in crisis. It's always in crisis, some sort or another. That's why it's so interesting to follow the country. Always they're having some kind of crisis. Now, this one is a real one, maybe one of the worst I've seen quite some time. But it's important for us to understand that the state really lives on crisis. That's how it holds itself together. Whether they're manufactured crises or real crises, whichever, the state lives on crisis. And it kind of builds itself on the crisis. It built itself out of the Korean War crisis. Think about that. All these rules, all these regulations, how they control the people, all stem from crisis. And this is not unusual to North Korea. We see this right here in our neighborhood too. An issue like this, everybody tries to pile on and grab control, right? Politicians will do that. Even doctors will try to do that. Everybody takes control. So that's my first point is North Korea lives on crisis. This is another, but a big crisis. Second one is similar, but it's easy to forget. A lot of people sort of wonder, how are they dealing with it? One thing about North Korea is if there's one word I want to use about North Korea, it is organized. It is organized top to bottom. It's probably the most organized state in the whole world, right? Everything is organized. It's not like a typical developing country in Africa or Latin America or even in Europe, even here, where people sort of do their own things and something goes wrong and they try to get organized. No, North Korea is always extremely organized. And I say top to bottom, I don't really mean necessarily a cone top to bottom. It's really much more of a matrix, top to bottom, bottom up. It's very, very complicated system with the party cells. I thought it was really interesting last week, the Asia Press had an interesting little article on how the Inminban how the regime was depending on the Inminban to manage this crisis. That's the party cells, the 30, 40 people, 100 people, 40 household kind of cells. But that's a socialist thing. The Chinese had it. I've been to the Chinese ones. They're absolutely horrible, from our perspective. It's a Stalinist system that was set up, but everybody has their community organizations. I mean, we have them here, our residents. People come knocking on the door, tell us we have the wrong color door. We get mad. Well, in North Korea, it's so intense, this Inminbang system, where everybody is watching each other. And that's added to by the criminal justice system where, one person goes bad and they can send their whole family to the camp, right? So everybody's afraid of everybody else doing something wrong. But the Inminbang has these leaders, and that's what this Asia Press article is about. The women, typically a woman, 40-year-old kind of woman who's running the community, does a lot of good things, organizes all kinds of events. But for something like this, something like disease prevention, that person is really in charge of that little community of 40 households. So that's where the control comes, really. It's peer control. It's not guns, really. It's not even threats. So much threat of going to jail. But it started with a ration system where the Inminbang could determine your rations, basically. It determines whether you go to the army, it determines everything, all about you in these small little groups. So that system has changed quite a lot, but this disease prevention, I'm sure, gets down to the Inminbang level, and everybody is watching everybody else. So if you're not getting your temperature taken, somebody's watching you, right? It's that kind of control system. Now, third point I like to make, this is unusual situation now, but it's not really unprecedented. And what has to happen with this system, if you call it kind of a matrix control system, information is terribly important. So, you know, we know, and actually, if any of y'all know what's happened to them, I haven't heard much about them anymore, but we used to hear about every household has its little radio receiver where they get directions from the party, right? The party sends out directions to the Inminbang leaders, and the Inminbang leaders then read it in weekly sessions to the people. So the information spreads from top to down through this radio kind of system. And then it's widely distributed through these party cells. But the opposite happens as well. This is my main point. The Inminbang collects data from the people and sends it up, right? You see this in China. We visited some in China. It's amazing. The kind of data that the Inminbang has on every person in their group, right? All kinds of health data. So I think it's probably not that hard for them to A, or make the order, and then B, send up the data through these. Now, how accurate the data, who knows? But I don't think it's that hard for them to do. It'd be much easier there than here in Herndon, Virginia, I'm sure of that. So the data issue is really interesting. And I'm thinking, again, maybe we can discuss it a little bit. I'm thinking that this radio system is broken down, kind of, and that the government has to push data out. I don't think the data is aimed at us, all this huge amounts of data. I think it's aimed at the party cells to tell the people what's going on. So they get energized and worried about it, but also feeling like they're participants in it. Now, the last point I'd like to make, because I'm an economist, I always like to make it. I think the system is changing radically. And what is changing about it is the use of money. So in the old days, it was the rations that controlled everything. So the Inminbang, the party, the work unit, whatever, all the units, they provide the medicines. They provided the food through a ration system. It never worked that well, but it worked okay. But since the famine days, the 90s, that ration system is really pretty much broken down, not totally. So the leaders get their rations, the Inminbang leaders get their rations, but the people don't get, the ordinary people don't. But there's a lot of discretion there. So the leader can distribute rations if she finds or he finds somebody really needs it, or somebody really needs some medicine. Okay, go to your group leader and they'll try to come up with it. So it's all very decentralized in this kind of way with these leadership in the Inminbang and in the party and in the work units and in the military. They all have them, everything. What's breaking down though is the money is crept into the system in a big way. So now we're seeing, I think, so with the rations, the state even is selling the rations at like 80% of the market price. Oh, well, that's so different than it used to be. It used to be kind of free. You get your ration free, and now you have to pay 80% of the market price for it. That's quite a difference. And medicines, you know, they put all the medicines in these, what they call pharmacies, state drugstores. This is about, 15 years ago. And so you go to the pharmacy and you have a card and you get, it's kind of like here, probably. You don't pay money for it. It's kind of like here, it's your insurance pays it. But there, that system is broken down. So now what's happening is people have to pay money for this medicine. You see that a lot in the daily NK reporting, Asia Press reporting. So I think the whole system is turning into a much more money-driven system. And if you think about that, that's pretty quickly will undo the Inminbang system, where it's made on polite sort of ordering people. Well, if you can pay the Inminbang leader, oh, and that's what the Daily Asia Press story was saying, that they're being paid now for the medicines. So everything is changing quite a lot here. I do want to emphasize, I think it's a very big crisis for them, but I also want to emphasize they live on crisis, and they know how to use crisis to really strengthen their controls, at least for a while. I think in the long term, it undoes them, but for right now, I think their controls are really tight. And that's all I want to say right now, but maybe I should spark some interest in some discussion.
Thank you, Bill, for touching upon all the important elements of their crisis management during the pandemic. Now, let me ask Ken to discuss the political aspects of this COVID outbreak in North Korea. Ken?
Okay, I will touch on the political aspects. I think Rachel and William already touched on some of those, but I'll give it at a higher level about what I think is going on. Over the last couple of years, the world has looked at North Korea with a rather raised eyebrow, as it's first claimed that it first had no COVID cases, and then now it mentions that it had COVID cases, and now they're reducing. So we see meetings where no one is wearing masks in the proximity of the leadership, and then we see the regime taking extraordinary measures to clamp down on the population. We see the regime looking inward, and we see tests and indications that Kim may be moving up the escalatory ladder in terms of his national security policy. Pyongyang watchers like to say that the more things change, the more they stay the same in North Korea. And I would agree with Bill and Rachel, and I think our previous speaker as well, is I think we need to take this with a grain of salt. While it might have some merit, I believe things are going on inside North Korea that warrant greater scrutiny. North Korea is not a static country, but it is evolving, both in terms of its policies and politics. COVID is having an impact on the regime, but how and to what extent is not clear. Things may not be what they appear to be. In order to understand the issue of COVID with regard to North Korea, we need to split our discussion into two parts: the early part of the period of the pandemic and the period after Pyongyang admitted to having COVID infections. In the first period, North Korea closed its borders early in January 2020 to shelter out the virus. The cost of this has been enormous. This must have been a tough decision for Kim Jong-un to make, since it essentially trashed the regime's survival strategy in the sanctions era. North Korea is subject to international sanctions, which limit trade. In the past, it has mitigated the effects of sanctions via informal trade and state-sponsored smuggling across the borders with China. But with the borders closed, this hasn't been possible, or it's been much more difficult. As many a U.S. official has said, COVID did what sanctions could not do. They sealed off the country. As a result, North Korea has experienced drastic food shortages. Reducing legitimate and illegitimate trade with China has also reduced economic activity, preventing North Korean goods from being sold across the border, and industrial supplies, consumer goods, and food from being imported from China. With food scarcity and incomes down, UN experts have warned that the risk of starvation looms for the country's most vulnerable citizens. The regime dealt with the crisis as it does with most crises. It clamped down. Over the last couple of years, we have seen North Korea take drastic measures to ensure no movement in the country, or very little movement. The markets have been closed down. The population has been sheltered in place for the most part. This move has elevated the internal security apparatus in Kim's calculus, as its leadership has been reshuffled to ensure that it efficiently and effectively carries out its missions. We have seen punishment being meted out to officials who fail to adhere to Kim's COVID instructions. Lee Pang-chol, the acclaimed official overseeing the defense industry, was demoted for botching his COVID responsibilities, although he seems to have survived and returned to a place of prominence and influence in the regime. Although not really talked about or recognized by outside observers, Kim Jong-un has used this period of lockdown to carry out some significant internal housekeeping within the senior leadership. At the Eighth Party Congress, Kim Jong-un oversaw an overhaul of many of the senior leadership bodies. A new generation of officials has taken up positions across the party, military, internal security, and cabinet apparatuses at the central level as well as at the provincial level. In addition, structural changes were made to the regime, such as the creation of the first secretary position, which is yet to be fully publicly defined. It is my opinion that Kim Jong-un has been laying the foundation for a future evolution of the regime to a more normalized footing, somewhat in regards similar to what William was talking about in terms of how the economy might operate under these new rules and regulations, as well as how politics will be played out. At some point, the country will come out of its self-imposed COVID shutdown. Eventually, sanctions will be lifted sometime in the future, who knows when. Kim Jong-un wants to make sure that the regime is able to take maximum advantage of these opportunities. Probably more important is that Kim needs to put a continuance of governance plan in place. There is no obvious successor who could step into his shoes if he were to die or become incapacitated. Many of these structural moves appear designed to create stability if the unforeseen were to happen. In any case, the crackdown during COVID, which has an anti-corruption component to it, has given Kim the space and protection he needs to carry out some changes that reached into the uppermost reaches of the leadership. Kim learned the lesson of the early years of his rule that of what could happen if senior leadership pushed back against the leader. Chiang Kai-shek paid the price when then, and now we see a much more aggressive approach to ramming through tough measures that Kim believes that will allow him a more political space and the ability to more effectively delegate authority, not power, but authority down the chain of command. So if we now take a look at the second part of this equation, the period after North Korea admitted that it had COVID. Over the course of the pandemic, North Korea has not acted like itself in these last, especially the last several months. We've gotten used to a regime that reveals little, that admits nothing, especially anything that can cast blame or vulnerability on the leadership. Well, that went out the window when it came to COVID. Although the regime long denied the existence of COVID in the country, Kim has made no attempt or very little attempt to hide the devastating economic impact from his people. I think both William and Rachel talked about the need to kind of reach down to the people with the seriousness of the COVID outbreak. He even appeared to make common cause with people's plight by losing a significant amount of weight in the summer of 2021. I am one to believe that this was done purposefully. It was not because he had caught some sort of illness or he had had some sort of serious health problem. While you can argue that the weight loss may be due to a realization that the regime is in trouble if his health fails, another reason might be that Kim does not want to look like a caricature of a fetid dictator overseeing a country of starving people. By being seen to lose weight, he claims solidarity with the people by showing that he too is affected by shortages, deflecting blame on the international system that has sanctioned the country. Equally, Kim has worked to cast his regime in a positive light by convincing the North Korean people, or at least telling the North Korean people that they are being protected from the virus by his government. Throughout 2021, we saw the regime's public messaging homing in on the country as more focused on this disease. In September, North Korea marked its 73rd anniversary of the founding of the country with a notably muted celebration compared to normal. Goose-stepping soldiers were replaced their traditional military attire with hazmat suits, and there were no lengthy displays of ballistic missiles. The fear and uncertainty surrounding the pandemic and its threat to power has dictated domestic policy to emphasize promoting national unity rather than displaying military prowess. As we move into late 2021 and in 2022, North Korea began to shift gears away from its complete lockdown to what looked like coming out of hibernation. We began to see military hardware in a succession of parades. North Korea has showing capability it has engineered despite the sanctions. We began to see some activity around the border with China. Now we are seeing North Korea lift the sanctions to a certain extent. It has admitted that it has COVID cases in the country. Whether it is a full-blown outbreak or part of a strategic messaging campaign remains to be seen. As we've seen with the speakers before, the numbers and the data are something that we have to look very closely at, and they don't necessarily seem to make a lot of sense on face value. We have seen public pronouncements by Kim Jong-un on nuclear doctrine. We have also begun to see an acceleration in the rewiring of the leadership with many personnel turnovers taking place. Just recently, we saw a turnover of nearly 30 individuals within the party, state, military, and internal security personnel. This is designed to put in place a host of domestic and foreign national security policies that will likely represent shifts in where Kim Jong-un wants to take the regime. He is dealing with the effects of severe sanctions and COVID. Liquidity within the regime is dried up, and Kim Jong-un needs to take a harder line to keep things together. He is dealing with a new conservative administration in Seoul and a US president that has returned to a policy of strategic patience. The time for diplomacy has passed, and there will likely be a return to brinksmanship in order to try to break the ice. I agree with Rachel that that the fact that Cho Sung-hui was put in as the Minister of Foreign Affairs does not necessarily mean a return to diplomacy. Most likely she has been put there to be able to deal with the blowback about what is coming down the line. In conclusion, COVID has had a rather dramatic impact on North Korean politics and strategy. It froze the regime in place for nearly 2 years and put things on hold, both domestically and in terms of foreign and national security policy. But now North Korea is at a decision point. It now admits it has COVID. Will it remain closed off and locked down, or will it come out of its shell and interact with the world, either diplomatically or through brinksmanship? It is giving indications that it will do the latter, but we will see. Thank you.
Thank you, Ken. I think you provided a lot of food for thoughts when people are carefully watching their Punggye nuclear site for any new activities. Our last speaker is Jae-hwan. Thank you for your patience. He's going to discuss the economic impact of a COVID outbreak in North Korea. Jae-hwan.
말씀해 주신 것처럼 코로나19가 북한 경제에
And
미치는
as you said, I'm going to tell you about the economic impact of the COVID on North Korea. So I have 4 points to talk about. The first one is the economic status of North Korea before the widespread of the pandemic. And after the pandemic, what action was taken by the North Korean authority? And what is the impact on the economy because of the actions? And I will draw a conclusion out of that. Before the COVID-19, and as you know, the blockade has been continued for about 2 years. There have been lots of economic difficulties in North Korea. Especially the quality of life were deteriorating because they were not able to import any daily necessities. This year witnessed a change because the trade volume with China has been increasing. As of April, the export increased by 3.3 times and the import increased by 5.5 times, but still is far below the average of previous years. The trade, especially import volume, has gone up significantly, especially related to agriculture products, daily necessities, and food products. And there have been some inflation. To curb down the inflation, they have increased the volume of the import. And you can see daily necessities and the food products and the agricultural products were the mainly imported items. North Korea has been underlining agriculture and construction. Agriculture is the basic foundation because they need to have food production to mitigate people's deteriorating living conditions, and they want to get prepared for the prolonged sanction and prolonged blockade. As for the construction, they can boost up the economy and they can build some houses. And there is a no significant outcome. So North Korea wanted to brag about their economic outcome with the huge construction. That is why North Korea focused on agriculture and construction. And after that, they faced the COVID-19 challenges. There are two big things. They stopped their cargo train. The trade with China was almost suspended. And they issued the travel ban. They imposed a tight travel ban. These two are the key measures that North Korea took. As they stopped the cargo train, according to the media report as of yesterday, compared to April, the trade volume with China has dropped by more than 80%. We are not sure how much travel restriction is being made in North Korea, but according to some sources from North Korea and from the media outlet, in the mid of May, there was some rice planting season, so minimum number of the people were mobilized and any outside activities were restricted. However, now they are easing the traveling ban right now. According to Daily NK, just about 10 days ago, the official markets were closed down. However, in the big cities, the gradual reopening of the market can be observed. In other areas, the local markets are open for 2 to 3 hours. According to Asia Press, in Haesan, the market was reopened and people started to return to their office. That means the travel ban is being eased in North Korea. North Korea says the number of the confirmed cases is going down, but I don't think the easing of the travel ban is mainly because of the better COVID-19 condition. It is mainly because of the economic impact. People were not moving, people were not working, and they were not able to mobilize the human resources for their agriculture. That is why they are easing the regulation for the travel ban. Then what can be the impact? The North Korea-China trade was coming to a halt and people's livelihood have been deteriorated significantly. The fertilizers have not been imported, which will have a significant impact on the agricultural production for this year, next year. The strict travel ban was imposed. The key industry is agriculture and construction. However, agriculture and construction is a human resources intensive industry. The travel ban can have significant impact, the negative impact on agriculture and construction, especially during the rice planting season. If people cannot be mobilized, the food production can be reduced, of course. North Korea is denying that. According to Rodong Sinmun, they say the rice planting has been 90% completed. However, according to Daily NK's satellite image analysis, compared to last year, the rice planting is only 75% compared to last year. They were not able to mobilize the human resources. In addition to it, it was really hot and there were some droughts in North Korea. In the case of construction, in Pyongyang, especially in Hwasong area, they are building 10,000 homes. According to RFA, the Chinese vaccine have been administered to the workers so that they can continue working. This shows that North Korea has the intention to continue its construction project. However, there will be some limitations. The biggest concern is the shrinking market activities. People cannot have access to basic necessities. In the case of Hasan, on the May 25th, there was a news 15-day worth of free food supply was distributed. However, it is unclear whether such a campaign has been widely accepted nationwide. People cannot have income from the market activities. However, the market activities has been constrained, so they will be reducing income, which means they are going to lose their purchasing power. As for the inflation and pricing, the corn and rice price has gone up, but not that significantly yet. But there can be two factors, thanks to the management and control of the state. And as I told you, North Korea is distributing some days worth of the free food. However, according to Asia Press a few days ago, last week, the rice price has gone up from the 5,000 won to close to 7,000 won. This is something that we should pay attention to. In conclusion, what I can tell you is the North Korean authorities stopped trade and they have imposed a stronger travel ban. Agriculture and construction are the key industries. They do not want to have any disruption, but there can be some disruptions, and COVID-19 is causing lots of economic activities disruption among the North Korean citizens. Considering the current trend, travel ban and the trade ban will be eased as time goes by, and that can be the future direction that North Korea is highly likely to take. As of yesterday, RFA said North Korea is trying to restart the cargo train operation so that fertilizers can be imported. However, China has rejected the offer considering the COVID-19 situation in Dandong. However, North Korea offered to reopen the cargo train. So trade will be recovered, travel ban will be eased as time goes by. That means the economic condition can get better. However, the COVID-19 situation can get worse and there can be more death coming out of COVID-19. So even with the higher death toll, North Korea is willing to ease its restriction, which means the North Korean economic condition is in dire situation because of 2 years of border closure. That's it from me. Thank you.
Thank you, Jae-hwan. Before we start the roundtable discussion, I'd like to remind the attendees that we are taking questions from you and that the Q&A box is already open. So when you type in your questions, please make sure to identify your name and affiliation. With that, let me open it up for a roundtable discussion. I think we have around 15 minutes for a roundtable discussion. So please let me know if you have any comments or questions for each other speakers. Yes, Bill.
Yeah, I think it's important for us all to realize that we don't understand the science of the disease. Nobody really does. We're not handling it well here either. You add that to all the unknowns about North Korea. Probably the biggest unknown for this problem is what happens when your temperature goes up. You know, there's no doubt that's happened to hundreds of thousands of people. I had the vaccine the other day. I mean, the booster the other day. My temperature went way up. 2 days later, it went down. I think there's just a lot we don't know, and what they don't know, nobody knows really how this disease will keep spreading or just suddenly end. You know, are they did they do a really great job of suddenly getting everybody with the Omicron or something that gave them some kind of immunity that wasn't so bad? I don't know. But my point is, we just don't know. And we need to recognize what we don't know. We don't know what's going to happen with that.
Right, and especially if after summer and the weather gets colder, then again we won't know what would happen, right? Probably they should be prepared for a worse situation.
I did have one other comment on the economic situation. I think because I meant to say it, you know, it's right. In April, the North Korean imports jumped up, still to a low level, but their exports did not really rise. So they ran a significant deficit for that 1 month of April. And immediately the won started dropping. The won is down, lowest it's been against the dollar for in about a year. So that's kind of a warning signal to the regime. As soon as they open up the border, things are going to come moving in. People are going to want necessities, parts, all kinds of things. If they don't get their exports going, which is no indication they're really doing that, they're going to have a financial trouble because they've got dollars in their wallets. They'll use it to buy products in China. Imports will surge, and the won will drop like a rock. They know that. They're very good at controlling it. So it's another big problem for them. Opening the border is not a easy thing for them to do, given their inability to export. If they could export, they could work themselves out. But the sanctions really prevent big exports, or they hurt. They can export coal, but not near as much as they would normally. Iron ore, all that kind of stuff. So I think their finance people, their government people, are in a real bind as what to do with the trade situation.
Okay. Thank you, Bill. Jae-hwan, do you have any comments on what Bill just said?
네, 통일연구원 이우태입니다. 제가 조금 더
I'm
첨언을
Yi Ute. Let me add some more. North Korean COVID-19 situation can be a crisis because we need to pay attention to the actual healthcare situation of North Koreans, because the North Korean health system compared to the Korea and other developed countries is totally different, and the level of healthcare is relatively poor compared to developed countries. We are simply relying on the cases reported by or argued by North Korea, especially focusing on Pyongyang. North Korea does not have a facility to take care of severely ill patients. What matters is whether North Korea can fully provide that kind of quality care. That's what matters, and I am dubious about it. There can be health threat to North Korean citizens because of the COVID-19. And 47% of the population is in famine, which means they are in famine. Their nutrition level is not that good, even with the distribution or administration of the vaccine. As Bill said, and when you get the booster shot, you have a higher temperature. If those who are in famine have some kind of bioreaction just like that, what matters is whether North Koreans can tolerate the vaccine or not, is what matters. So there can be some political or economic impacts coming out of the COVID-19. However, what matters directly is the healthcare situation and the health of the North Korean citizens. That is why the international community should pay more attention to it.
Thank you. I guess when it comes to the North Korea's official data, there could be some parts that can be easily covered up and other parts that cannot be easily covered up. I don't know, exactly which parts would, fall into each category. But for example, the authorities recently announced that at first it was Pyongyang, but now it is the rural areas that increasing number of people are getting sick, getting fever in their case, and children are more vulnerable than the adults. That's what the authorities officially says. So probably that's something they cannot cover up. But when it comes to this pandemic that affects the whole nation, it could be really risky for the authorities to just send out government propaganda and saying everything is getting better, much better, dramatically.
Yeah.
Just trust us. So I was wondering, Rachel, do you have any thoughts on that?
I think that when they decided to provide these very detailed tallies, right, by region, daily tallies, even deaths, I think that they knew that they were not leaving themselves a lot of flexibility in terms of any major underreporting of numbers. And I think that if they had any kind of a plan to fabricate numbers in a major way, that they would have maybe taken a different route to start with, that maybe they would not have provided such numbers. Because when you start to fabricate numbers in a major way, right? I think that carries a lot of risks for people. So for example, if your neighbors, if your family members are getting sick and they're dying, but the state media are telling you that the situation is getting better and that the number of infected people is dropping, and that the number of recoveries is growing, and that the number of deaths is stagnant, I'm not sure that the people will buy that. So that's my take on that. I think that they would have taken a different route, that maybe they would have been provided less details in terms of reporting on the tallies.
Thank you, Rachel. Yes, Bill.
Yeah, one thing I would, I like what Ken said, everything. I always like what Ken says about the politics. But one thing I might push back on a little bit is ever since, was it Hanoi? Yeah, ever since Kim Jong-un came back from Hanoi, he's been going around and doing a lot of criticism. He'll go to a factory, a pharmaceutical factory, and say, why aren't you as good as Singapore? In Singapore, they have really good, why can't we be as good as Singapore? And yet he blisters the poor manager. So many, the year or two after he came back, I thought he was really being very critical of his own government's management in a very different way. Not so different. Kim Jong-il did the same a little bit. Kim Il-sung did a little bit. But they seem to like, they're not adverse to blaming people, blaming their own authorities for screwing up. So I'm not, in that sense, I'm thinking, they're making room here for a major screw up. Because the big policy was to keep it out. Now it's in. The disease is. So somebody's, screwed up. And it seems like he's going to have to point to some people and get rid of them. But so far, it doesn't seem like he's doing that. But I quite agree with Rachel. The blowback potential here is just huge, because I think it's at every little level, every Inminban level. If people are thinking they're being lied to about something this important. One more thing on the deaths, they say, 3 or 4 or 6 deaths. if you think about it, North Korea has about, I figured really roughly about 1,000 people die every day. 900 people die every day, just population. So if they're saying, you know, one or two of them are dying from, how do you know what the rest of them are dying from? You know, most of them now, by now, a third of them or half of them have the temperature, right? So, you know, how do you know what? I mean, it's the same problem everywhere, but there it's exaggerated by these incredibly low numbers of quote deaths. So I think they're really straining credibility there. Now, it may be that North Koreans are totally used to being lied to. I kind of suspect that's the case.
Thank you, Bill. I wonder if our Korean speakers have any comments or questions.
예, 그 좋은 말씀들 많이 들었는데요. 뭐
Thank you
저도
very much for the good remarks. Thank you. And let me be a participant for the discussion. Let me put a topic like this. Currently, the COVID-19 crisis is like you are doing a overdue homework in haste. After the Hanoi no deal, North Korea is working on 자력갱생 or self-reliance once again, so that they can develop themselves only with the internal resources and internal capability. They are facing the sanction and they have the self-restriction they've been maintaining quite okay. However, COVID-19 has become a huge hurdle against them. So North Korea recognized that it cannot be handled only with the 자력갱생 or internally or self-reliant. So North Korea is now opening up the actual condition of COVID-19, and they are trying to overcome the COVID-19 crisis. The leadership in North Korea will reinforce their leadership. The leader and the party are handling this crisis. The COVID-19 case is going down and we are doing it okay. So they can use this kind of a condition to reinforce their leadership or authority. However, after that, about the food and their one style of the socialism development can be impaired. In that case, there will be huge damage to their leadership. So considering the current situation, after the launch of the Biden administration, there has not been a dialogue between the US and North Korea. After the launch of the Yoon Suk-yeol administration in Korea, there has not been a dialogue. Still, North Korea is working on long-range missile testing. It is launching the missile. It is creating a crisis. And there is a news that North Korea is prepared to the nuclear testing. And North Korea is almost ready for nuclear testing at any time. As Ken said, probably North Korea is on a kind of a turning point. They need to decide something new. So what matters is the response from South Korea and the US. The response from the US and South Korea may be dictating the future decision of North Korea. Of course, North Korea can make their own decision, but the response from the US and South Korea can have some influence on the decision of North Korea. North Korea is now preparing for the nuclear test, but they are not actually doing the test. They are kind of waiting for a signal. If South Korea and the US are delivering a new message, probably we can have another negotiation with the negotiation token that North Korea shall not do any nuclear testing. So there can be another negotiation point. So considering all that, we are at the critical juncture, and the US and Korea should be on the same note, and we need to work together so that we can make the best decision. There can be some examples. For example, Choi Sun-wi was appointed as a Minister of the Foreign Affairs. In the past, the Foreign Affairs Minister was Lee Sung-gun, who is from the army, and he is like a Kim Yong-chol. He is on the strong line. However, Lee Sung-gun was appointed as a Unification Minister, and Choi Sung-hee was made as a Foreign Minister, who is a diplomat, which means maybe North Korea can be open to the negotiation, or at least they have negotiation as an option at least. And we can have some more discussion on this. Thank you.
Thank you, President Ko. We have around 10 minutes left, so I think we can take some questions from the audience. Bill, do you have any comments briefly?
Just a response to that. I thought this very interesting idea. And one thing I'm seeing is I think the idea is that they've gone to the self-reliance mode, but now this breakthrough on the virus is sort of upset that, and maybe it gives some kind of an excuse for the regime to back away from that and to ask for help. And one thing I think I noticed in the Nonong Shinbun reporting on it, which incidentally today there was just a really amazing report of how bad the situation was. It's worse since the Korean War, basically. I think I'm seeing that they're saying, we did better than the rest of the world. We held off for 2 years and so many months, but now we got it. It seems like you might possibly, I think that's what the director is saying, that might be kind of an opening. So, okay, so let's work with the rest of the world and solve this problem. So it's an interesting idea.
Thank you, Bill. We have a couple of questions from the audience. The first is from Roger Weatherall. What are the extents of the maximum quarantine? Are they as extreme as in China, where people are being locked into apartment buildings? And what effect do you think this is having on the population? So I think Jae-hwan briefly touched upon this issue, but Jae-hwan, do you have anything to add on this?
이 질문이 있고 나서 제가 나중에 이제
And on this question, and probably I made a presentation after this question was posed. Initially, there was a travel ban, and the minimum economic activities were allowed, like planting the rice. However, as time goes by, they have eased the restriction level and the travel ban, and now the market is working temporarily. So I can say the trend is easing the restriction.
Thank you. And we have two more questions, but I think they're basically asking the same question, two questions, one from Jonathan Kairella and another from Pei Young-kyung, reporter working for Yonhap News. So basically, how credible the official data North Korean government is providing, that's ongoing dilemma. But Min-young, you imply that we can give a certain amount of trust, if you will, to the official data the North Korean government has been providing. But do you have any big question mark here?
I think the data that the North Korean state media are providing to a certain extent reflect what is being reported to the government from the ground. That said, I would like to say my personal view is that I don't think the numbers necessarily reflect the realities on the ground, simply because of North Korea's limited testing ability. People's access to medical facilities, I'm assuming, is very limited. So in that sense, do these numbers reflect the realities on the ground? I'm not a medical expert, but I am skeptical. But in terms of the media, the tallies, I think those are to a certain extent based on the numbers that are coming in from the ground.
Okay. Yes, Bill.
Yeah, that brings up to me another question. And maybe an opportunity, really. If you think about it, North Korea is what? It's the only one other country in the world is not inoculated, right? Ethiopia or somebody. So here's a case. The world, or WHO, none of us know the path of this disease very well. We don't know how effective the vaccines are. We don't know very much about it. It's really a crazy disease. But North Korea is now a huge laboratory experiment in the invasion of a virus on an unvaccinated population, a big one. And then they have a big response. And then they say it's going away real quickly. Well, it seems like that there's some really valuable data there for the WHO or for other people to get in there and say, okay, let's figure this out. You can help us. In other words, North Korean data should be able to cast, if it's good data, they should be able to help all of us figure out what's going on with this disease. And I wonder if any of y'all know, if any, presumably WHO, not everybody's understands that and are trying to talk to the North Koreans. Does anybody know of any of that happening? You see what I mean? I think North Korea has something very valuable for the rest of us in terms of this data. It's just we don't trust what they're reporting, but there's a lot more surely behind it. What happens when the person recovered? And is he fine? You know, who knows?
Thank you, Bill. We have 5 minutes left, so just in case we won't have enough time to cover the 2 questions we have. So let me just bring that up simultaneously and ask the speakers to respond to whichever question they would like to respond. So first one is from Kyung-sung Kwon, a visiting scholar at GWIX. His question is this: North Korea is currently in de facto isolation. Overall international trade was cut off due to economic sanctions, and imports from China were greatly reduced on its own in the name of preventive measures against COVID-19. In this situation, it's questionable for me how effective strengthening sanctions will be in attracting North Korea to the negotiating table and leading it to denuclearization. Rather, I think it's time for the US to suggest easing sanctions as an incentive. So Ken and President Cole, if you have any response, please let us know. And the other question is about North Korea's regime stability, how the pandemic would, impact any impact of the COVID-19 on the regime stability in North Korea, if there's any. So I think, Ken, this is the time you can speak up.
Yeah, I mean, as most of you probably know, I've been a long-time advocate for easing sanctions on North Korea. I think it's the only way forward. I think otherwise we're stuck in this status quo going around in circles. and really not making much progress. The problem is it's going to be very difficult politically inside the United States and in South Korea to make those to engage with North Korea. We keep talking about engaging North Korea without preconditions. Well, North Korea has a very big precondition, and that means sanctions relief has to be put on table up front. And I think that's what they're hoping for. I think the reason that Cho Song-hui was put into place is that she is the one diplomatic strategist in North Korea that can pivot in one direction or another, whether they go brinksmanship or whether they go diplomacy. She's very adept at talking about the nuclear program. She's also very adept at really kind of picking apart our arguments on the diplomatic realm as well. But for this all to happen, the Biden administration is going to have to get rid of strategic patience and actually start to actively engage with North Korea. Otherwise, nothing's going to happen, because I can pretty much guarantee you, or at least it's my strong opinion, that North Korea is not going to come crawling to the international community asking for assistance and aid. They are going to still continue to play, relying on self-reliance if they have to. I think part of what Bill was talking about is absolutely right. The criticism that we see of officials. That is by design to try to send a message down the chain of command, because Kim wants to push authority down the chain of command to make the system work much better if it has to act within isolation. He's hoping that's not the way they have to go, but if they have, their preference is to engage the outside world, but they're going to do it on their own terms. So yes, I believe we should try to find a way to engage, but I think politically inside the US and inside South Korea, that's going to be a very hard thing to do.
Thank you, Ken. Do we have anybody else who wants to have the last word? We have only 1 minute left, so please let me know. Any comments, last comments from our Korean speakers?
네, 아까 제재 문제와 관련해서 질문 주신 거.
And the question regarding the sanction or the restriction, as Ken said, sanction and the restriction are not the silver bullet that have been proven with history. So dialogue should be resumed. That's a must. What matters is, what is the preconditions? North Korea will not come to the table without preconditions attached. There was a Hanoi no deal. North Korea is asking for Yongbyon plus Alpha, freezing the nuclear facilities or permanently close those facilities. And North Korea is saying we cannot do it, otherwise the hostile policies are scrapped. I personally believe North Korea, after its failure Singapore, they worked on the ICBM testing, and their negotiation card is the 7th nuclear test. And how North Korea will use it is going to be really important. And probably North Korea can come to the table under the condition that we are not going to do this kind of nuclear testing. That can be their negotiation card. Thank you very much.
Thank you, President Ko. I'd like to thank all the distinguished speakers for joining us today, and especially Rachel for staying up late at night for us. What time is it now there, Rachel?
It's 3:30.
3:30. Oh, you should go to bed right after this webinar. Yeah. Thank you again for joining us from Vienna. And I'd also like to thank the GWIX and KINU team for putting this together. And of course, thank you all for joining us. And with that, let me conclude today's webinar. Stay healthy and thank you, everybody.